Lateral epicondylitis, better known as tennis elbow, is not only found in tennis players, but anyone that does repetitive arm and especially wrist extension motions. The wrist extender muscles originate on the outside part of the elbow, cross the wrist joint, and form into tendons of the fingers. Icing should be done multiple times a day at the muscle's origin until the pain is completely gone. An ice pack for 15 to 20 minutes is recommended. To warm up, perform gentle range of motions of the wrist. Flex the wrist, then extend back to neutral for 10 times. Next, follow this with a full wrist and finger flexion stretch. Make sure to keep the elbow fully extended. Each stretch should be held for 15 to 20 seconds and done multiple times a day. Another way to do the same type of stretch is to use a wall. Again, elbow straight and wrist flexed. Once the pain has decreased, you may begin strengthening exercises. Start with eccentric or negative contraction of the muscle only. Support the elbow and forearm on a table with the backside of your hand facing upward. Extend the wrist fully. Once extended, place a weight in your involved hand, then lower the weight down. Remove the weight and return your wrist into full extension. Build up to 3 sets of 10 repetitions. The same type of exercise may be done with a stretchy band. Again, make sure to focus on doing the negative or lengthening contraction of the muscle only. Remember to build up to 3 sets of 10 repetitions. If your pain increases, you may be doing too much too soon. A flex bar is another tool that may be used to perform eccentric contraction exercises. Hold the bar firmly in both hands. Twist the non-affected side forward while stabilizing with the affected side. Now slowly allow the affected side to rotate forward. Remember, only rotate back to the starting point with the non-affected side. Build up to 3 sets of 10 repetitions. If you are feeling little to no pain with the previous eccentric exercise, you may move to doing both concentric and eccentric muscle contractions. These may be done using a dumbbell or stretchy band. Build up to 3 sets of 10 repetitions. Massage may help as well. A gross rubbing of the muscle is okay, but is not as effective as a cross-friction massage shown here. Apply light to moderate pressure to begin, and remember to massage across the muscle, not with it. A counter-pressure elbow strap may help during activities. Secure the strap slightly below the elbow joint. Find the bony knot on the outside of the elbow and place the strap just below that. Don't allow the strap to fall down on the larger part of the muscle belly. So we can continue to make these free educational videos, please subscribe to our channel.